Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Did you know that August 30th is National Grief Awareness Day? Grief is something we all will face at some point in our lives. It's universal, and yet it's misunderstood and often too taboo to discuss. But understanding grief is critical for our mental and emotional well-being. Many celebrities have spoken publicly about their grief and loss, including Michelle Williams about losing ex-fiance Heath Ledger, Khloe Kardashian about her father Robert's passing, and President Biden about the death of his first wife, baby daughter, and adult son. In today's show, I'll talk more about why grief awareness matters, the Kubler-Ross Stages of Grief, symptoms of grief, tips for coping with grief, and ways you can make a difference. Let's get started. So why does grief awareness matter? Grief is the experience of coping with loss, which comes in many different forms. You may grieve the death of a family member, friend, colleague, or pet. You may grieve the loss of a job, a friendship, or marriage. Grief can accompany any event that disrupts or challenges your sense of normalcy. It can be complicated by feelings of guilt and confusion, especially if the loss was a difficult or challenging relationship. For example, the death of a father who abandoned his family, or the loss of an abusive aunt. Now I'll talk about the Kubler-Ross Stages of Grief. In 1969, Swiss-American psychiatrist Dr. Elizabeth Kubler-Ross described her theory on the 5 stages of grief in her best-selling book On Death and Dying. The 5 stages, denial, anger, bargaining, depression, and acceptance, are non-linear and can happen in any order. You might not even experience all or any of the stages, and that's okay. Grief is highly individualized and unpredictable. So what are the symptoms of grief? Grief can affect every aspect of your life, physical, emotional, and spiritual. First, the emotional symptoms. People often describe their emotions as coming in waves. One minute, you may feel like life is back to normal. The next minute, you're sobbing uncontrollably, and for seemingly no apparent reason. Has this ever happened to you? It's happened to me. You may experience confusing and conflicting emotions such as sadness that your grandfather is gone, but relief that he's no longer in pain. You may also experience guilt for the relief that you no longer feel exhausted in caring 24/7 for your terminally ill mother. Remember, there are no right or wrong emotions when it comes to grief, but it's important to acknowledge and feel them in order to heal. Second are physical symptoms. Loss can be an extreme stressor on the body. It can take a massive toll on the body. It can weaken your immune system and make it easier for you to get sick. Physical symptoms associated with grief include headaches, nausea, heart palpitations, tightness in your chest or throat, fatigue, upset stomach, changes in appetite, sleep changes, and many others. Third are behavioral changes, which include confusion, hopelessness, difficulty thinking, concentrating, or making decisions, as well as memory issues. So some tips for coping with grief. It takes time and patience. Remember to take care of yourself. Exercise, eat regular and healthy meals, take naps, take a bubble bath, get a massage, go see a movie, stick to a routine, reach out to others, remind yourself of all the connections you have and the people that want to care for you but may not know how. Sometimes professional help is needed when working through grief, especially if your symptoms are interfering with your daily life, especially after 6 to 12 months. Tips for supporting a loved one who's grieving. Be present. Make yourself available. Ask them what they need. Offer to help. Laundry, cooking, groceries, babysitting, and convey your openness to talking. Let them know it's okay to share their thoughts, feelings, and stories with you. And when they do, try to listen more than talking. So, ways for you to participate. There are so many ways to participate in National Grief Awareness Day. You can reach out to a close friend or a loved one who's going through a tough time, offer a supportive ear, or attend an event, live or virtual, around healing. You can also learn from, donate to, or volunteer with organizations like Good Grief, NYC Well, the Dougie Center, the National Alliance on Mental Illness, or NAMI, and many others. Well, that's all for today. Here's your joke of the day. And yes, even for grief, because sometimes humor is the best way to get through pain. What's the first stage of grief experienced by an Egyptian? Denial. Be sure to subscribe to my YouTube channel, make comments below, and follow my Instagram at Health, Humor, Harmony, Dr. Roy. Be well, and I'll see you soon.